Right, I just want to talk about how I've adapted and changed some routine projections in the past sort of, well, year really. Firstly, I want to talk about these two deaf patients that I've done. One an elderly gentleman and one an elderly woman. The elderly woman was completely deaf, could not hear a word I was saying. So basically, she didn't have anybody with her either. So basically, for communication purposes, I took a pad of paper and just wrote down everything that I needed for her to do. So I just, made sure there was no metal in the chest area. So we're doing a chest X-ray. Made sure she was okay with the examination. Got her to confirm verbally her details, even though she was deaf. She could speak. She could lip read as well, but it was more efficient to do it on paper. And then when I was telling her to breathe in, I would just basically get somebody to prep the X-ray machine for me, and I would stand in front of her and just basically action her to breathe in, and then hold her breath, and then I'd just run round the back of the screen and expose. And that seemed to work quite well, and she was fine with it. And then she thanked me and stuff like that. And then the elderly gentleman, I don't think his eyesight was that great either, and I don't think so. Basically, what I did was, this guy was really old, and it were a bit abrupt. But basically I was shouting at him, to be honest, really shouting in a polite manner, but I was shouting really into his ear. And then again I did the actions, I do this for children as well, for young kids that can't really, because I think they respond to the actions a little bit better. So if you do the action of like, breathe in, and then you run, you get somebody to prep it for you, then you run it round and then you take the exposure while they've breathed in. So that's quite fun actually, I quite like doing that. Another examination when I've changed my technique was this was last year, and I was in A&E and a woman had come in with a big laceration on her knee. She'd fallen onto some gravel, and basically we were x-raying to see if there were any sort of gravel caught in this big laceration. But she was kind of sat on a bit of a diagonal, and she would not move. She didn't want to move at all. She was really scared and she was really upset. So basically, with the knee being a little bit cockeyed as it were an angle, to do the AP, I placed the medium cassette just underneath her knee, with a pad placed underneath it to place the cassette perpendicular to her knee, so it was on the right sort of plane of angle. Then just angled the tube so we could get a nice AP and get through a knee joint. And then for the lateral, all I did was swap it round. I would basically put the cassette this way on and support it with a pad, and then just come in from the side like that to try and get the best lateral that I could. So it was kind of like a hori beam lateral, but more like a diagonal horizontal beam lateral. And that works quite well. I got it for the first time and I'm quite impressed with that. So there's some of the two. Also, I've been doing more weekend work this time, and there's less here, and I've had a lot of trouble with people that don't speak English, especially when we're doing breathing in techniques, because some people come in without a relative and they don't know that much English anyway. So I get the helper to come in, if the helper can speak their language, or an interpreter to come in. I haven't actually used an interpreter yet, but I usually use the helper who can usually speak the language, whether it's Hindu or I don't know what language it will be, or Punjabi or something like that. And then I'll just get them to basically explain the procedure, to come in to tell me their details, and then to help me to tell them to breathe in, hold the breath, or either breathe in, breathe out when we're doing a spine X-ray, and hold the breath. And that usually helps if they give clear instructions. Then it usually helps. Doesn't always work, but it usually does the trick for me. And that's about it really. The one that I really liked is the adapting technique, where I like to do that quite a bit. I've done it a few times where we've just patients been in a position where she won't, it's hard for us to move them, so we just move the cassette and the tube accordingly, and it works quite well. Yeah, thanks.